were all taught in medical school that ketosis was horrible. It meant you were about to die of diabetes. Most doctors have a real negative feeling about this. And it brings up one of the really interesting parts about medical education. Part of what we were taught is wrong now. And every year, more of it becomes wrong. So you have to constantly be filtering through what you thought was true and figuring out if it's still true. The answers change, the questions may stay the same. Ketosis and diabetes have an interesting relationship. Ketosis makes diabetes get better. You don't have to have a bunch of insulin to burn fat. The other interesting part about ketosis that I should mention is that most of the history of mankind, a ketotic diet was eaten. Only in the last 5% of our time on Earth have carbohydrates taken over. So your body is programmed to burn fat originally. Now it's getting reprogrammed to burn sugar almost exclusively. You can see the effects on our society. There's two ways to become ketotic. You can either fast or you can consume fat. Or you can eat nothing but fat and get there quicker. Certain types of fat make you ketotic quicker, but all types of fats are positive in this direction. When glucose is not available, your body switches over to burn fat. There's a thing called fat adaptation that if you haven't eaten fat for a long time, it may take you a while to get back into that, but it still happens. This is associated with weight loss, increased energy, and increased mental alertness. In fact, I got interested in this because of podcasts saying if you want your brain to work as well as possible, you need to be ketotic. When you get to be my age, you start caring whether your brain works very well or not. Now, I have a friend and a patient that I told a few months ago, maybe quite a few months ago, that he should try this for his diabetes, and I would like for him to give you a little testimonial. Gary, would you come up here? Not all patients are the same, as we all know, and this may not be the right treatment for everybody, but if you can get a patient that buys in on it and they can make it work, it works wonderful. This is Gary. He had coronary bypass surgery in 2013. He got put on insulin at that time. And Gary's going to tell you about how he learned about ketosis and what it did for him.
Okay, thank you. So CD one night told me that if I would change my diet to a keto diet, that I could get off insulin. And he'd been telling me since my surgery that, I needed to get off the insulin, needed to find a way. So he told me about a book, Keto Clarity, that he would recommend, and I downloaded it that night from Amazon. I read the book, and I never took another insulin shot after that. I was able to adapt to ketosis rather quickly. I quit taking insulin completely. That was 18 months ago. My last blood sugar was, or my A1C was 5.9, which was down, way down, half of what it was when I had bypass surgery. So it's been a big benefit to me. Energy, my energy's back like it was when I was a much younger man. The brain fog that I didn't even realize I had, I guess. After about 3 weeks on this keto diet, I realized one day that, I could think clearer, I could even see better, than what I could 3 weeks before when I started this. So, it's been a big benefit to me. I'm a firm believer in it. I share about it. My whole family now, most of them, not all of them, not everybody buys into it, but most of them now eat that same way, and they found the benefits from it. So, incidentally, I lost 26 pounds rather in the first 3 or 4 months, and kind of sustained it from that point forward. So it's an easy diet to adapt to. You know, it's all the stuff that tastes good is the high-fat diet. So it's easy to maintain that.
Tell them what you eat for breakfast.
Breakfast, I have coffee, bulletproof coffee for you guys that know it, which is, you know, grass-fed butter and MCT oil in my coffee. And I have 2 cups of that every morning. I usually don't eat until the evening. I'm not hungry. If I get a little bit hungry in the afternoon, it's usually 3 o'clock or so, I'll have a couple of cheese sticks to sustain me over to the evening meal. My evening meal, I'd say half the time is simply a salad. And on my salad, I don't use the dressings that you buy. I use mayonnaise and olive oil, or mayonnaise and avocado oil, because they're fat, no sugar added. You know, it's what feeds the diet that I'm on. So other nights I eat, you know, I'll have protein. We eat a lot of salmon. You know, I'll have red meat occasionally. But, you know, it's always vegetables with it or salad with it.
Tell them about your exercise.
Exercise, I walk. You know, I walk 40 miles a week is my average. And I have the energy to do that. You know, in fact, when I don't do that, you know, I don't have as much energy. So I'm a firm believer that the combination of the exercise and the diet makes a difference.
Any questions for Gary? Thank you, Gary.
There's
Name of the book? The name of the book?
the name of the book, Keto Clarity, by Jimmy Moore and Eric Westman, I believe, is the doctor.
Thank you, Gary.
Sure.
Okay.
As you can tell, Gary's not an average patient, but he is kind of the patient of the future. The patient that steps up and takes over his own case and takes care of problems. Ketone metabolism, interestingly, turns out 30% more energy than sugar metabolism. So you get more energy, but the other side effect of this is it throws off less free radicals. So it reduces inflammation in your body. Inflammatory-related diseases get better. Alzheimer's, interestingly, gets better. Parkinson's gets better. Rheumatoid arthritis gets better. Things that are inflammatory. Probably blood vessel disease and heart failure should get better, but that's really not ever been documented. We could probably document that because we just ordered a machine to measure serum ketones. Serum ketones are not a standard test in hospitals, at least around here. But if you really want to know if you're ketotic, you got to measure it in your blood. A little ketone in your urine does not prove you're significantly ketotic. One other comment before I turn it over to the others. The American Diabetic Association, y'all have probably seen that term before. The ADA diet. The ADA diet is, well, number one, the ADA doesn't want you to know about ketosis for diabetes treatment because the ADA is funded by pharmaceutical companies. They refuse to tell me how many dollars they get a year from pharmaceutical companies, but they do have on their profit and loss statement, they get $41 million in donations. So they don't want your need for insulin to go away or all those other 20 new drugs for diabetes that many of us don't understand. But anyway, the ADA is not our friend. And unfortunately, it's true of every medical society that I know of because they all are on the take from drug companies. I'm not talking about local societies, the big ones. And the ACC, the Cardiology Club, is high on the list. I wish it wasn't that way, but that's it. I may be getting a little cynical in my old age, but... Now, the reason that this therapeutic ketosis is different than diabetic ketoacidosis is simple. Diabetic ketoacidosis is triggered by high blood sugars. If you have a high blood sugar, it creates osmotic diuresis. You lose a bunch of volume, you become hypovolemic. Your body recognizes that as a stress response. Stress response runs up your sugar, runs up your blood pressure, runs up your cholesterol. All the negative things of stress responses come out. That then makes the situation worse, and the acidosis is due to hypovolemia. Now, it is true that ketones are acidotic, and I was taught in medical school that that's what caused the acidosis. That is not correct. There's people that are carrying massive ketones around with normal sugars, and they are not acidotic. If you have inflammatory disease, or if you're old and your brain's slowing down, you might want to try this. I've been doing it for most of a year. It's pretty easy. You don't eat as much. My weight hasn't changed at all, but I have more energy, and I feel great. Comments about weight loss?
Well, you know, the weight loss aspects of a ketogenic diet have been pretty well described from all the way back to Dr. Atkins, who, by the way, was a cardiologist, as you may or may not know. And it's all about the interaction between your hunger mechanisms and satiety. And when you take a ketogenic diet, the first thing you're doing is eliminating a lot of the filler in your diet, the breads, the pastas, the things that we tend to overindulge in because we don't get satiated from these foods. When you adopt a ketogenic diet, you really aren't as hungry. You really don't have to eat as much. In fact, if you really do the low carb, the Atkins diet, sometimes you feel like you can't even eat enough to get your calories. And so a lot of times they will say, if you do an Atkins diet, you need to supplement with a multivitamin of sorts. It works. I mean, I'm known around the hospital as the guy who's always doing the ketogenic diet intermittently because it is somewhat of a challenge when situations arise. But I'm a big firm believer in it. One of the most amazing stats that I've ever seen was actually published in National Geographic a few years ago, where they traced the gigantic escalation in diabetes mellitus to the advent of the easy availability of refined sugar. And it's an incredible statistic.
Dr. Rollefson's diet's also augmented by Diet Coke, which is not part of a ketone diet.
You know, that was last year's talk. Okay, but
You're not doing it anymore?
I still do enjoy a Diet Coke on occasion. What time is it?
Your turn.
Dr. Hendricks.
My turn. Okay, and I've got slides. I'm supposed to push this once and wait. We'll see what happens. There we go. Step down here.
Let me get out of the way here.
So I'm talking about neurology and the ketogenic diet. And the reason I'm emphasizing that it's the ketogenic diet is because I think this was our first introduction into what a ketogenic diet could really do, the potential for it. In the work I do, I work with people with a lot of chronic illnesses. We use different diets for different things, and then we individualize the diets based on their individual conditions. But we've seen a lot of different diets over the years. Diets for helping with diabetes, heart disease, seizure disorders, other neurological disorders, GI disorders, and inflammatory diseases. And we found that we see a common theme in the diets that help all these different conditions. The ketogenic diet actually originated in 1921, developed at the Mayo Clinic, but really gained in popularity at the Johns Hopkins Hospital. Basically, high fat, low carb. That's how you make a ketogenic diet. It didn't gain in popularity until later 20th century. And the person that I associate with learning about the ketogenic diet is Charlie Abrahams. He turned 1 in 1993. That's when he started having seizures. By 20 months old, he was having up to 100 seizures a day. He only weighed 19 pounds, and he had had brain surgery, numerous different medications to try to control his seizures. His parents were at that point willing to try just about anything. In fact, they did just about try anything. They learned about the ketogenic diet. They went to Johns Hopkins. They began the diet. His seizures were gone in 2 days. And he was off medication within a month. And I'm like, wow, there's really something to this ketogenic diet when we're looking at seizure disorders. His dad had found a book by John Freeman, and John Freeman was at Johns Hopkins doing the ketogenic diet. And there were like 4 or 5 pages in this huge book, 4 or 5 pages that talked about the ketogenic diet. I read someplace else that Dr. Freeman actually tried to publish a book about the ketogenic diet, but at that time, no one would touch it. No one would publish it. So he was able to slip the information in, just those 4 or 5 pages, into this book. So Charlie Abrahams was having these seizures. Did I go backwards? I did. I hit the wrong button. So his parents saw what had happened for him. So they set up the Charlie Foundation for Ketogenic Therapies, originally just looking at seizure disorders, epilepsy. And his dad was a director in Hollywood, so they made a movie, and it's called First Do No Harm. So some basic information on ketogenic diet and epilepsy you can find at the Charlie Foundation website, and it's a really interesting movie, kind of sensationalizes some of what they went through, extra Hollywood additions in it. The ketogenic diet, as done at Johns Hopkins, was traditionally started with a 48-hour fast. That was how they kind of jump-started the diet. And then gradually added in calories, but still high-fat, low-carb over a 3-day period. With the ketogenic diet, it can be a challenge to do. You have to have very precise measurements. You work with a dietitian that helps you measure everything for the parents to learn how to do this. It's okay for any age range, infancy through adulthood. Doesn't matter the etiology of the seizure type. About a third of the patients using a ketogenic diet will have more than a 90% reduction of their seizures. And that's the diet. That's not diets and meds, that's the diet alone. Historically, the ketogenic diet has been the last treatment option. We'd always try medications first, but if they failed 3 or more of anticonvulsant medications, then they would go on to the ketogenic diet. So, as has been discussed, the ketogenic diet is providing ketones as fuel for the brain. There are some specific medical conditions that the ketogenic diet is perfect for, in addition to all the other things that have been talked about, because these 2 conditions need ketones to run. With these 2 conditions, people can't process glucose adequately, and so they're not going to thrive. GLUT1 has to do with glucose transport across the blood-brain barrier. When people have this, they may be having seizures, developmental delay. It's ideal case to use a ketone diet in it. And then PDHD, which is a mitochondrial disease, pyruvate can't be metabolized into acetyl-CoA. So again, use ketones, burn ketones as fuel. There are some other specific epileptic conditions that the ketogenic diet seems to be ideally suited for. Dravet syndrome, and we're also finding that there may be some other new therapies coming along. I don't know how much this will be talked about later this afternoon, as far as cannabidiol, CBD oil, in some cases of epilepsy, tuberous sclerosis. There are some absolute contraindications when you cannot use the ketogenic diet. If somebody has a primary carnitine deficiency, if they've got a carnitine deficiency, you cannot get the fatty acids into the mitochondria, so this would be a contraindication for it. If there's some other impairments of carnitine metabolism, and of course beta oxidation defects, pyruvate carboxylase deficiency, porphyria, and you have to rule out some other inborn errors of metabolism that might make this diet not work well. Relative contraindications have to do with just being able to maintain adequate nutrition in someone following this diet. Another relative contraindication, if a surgical focus has been identified, if they identified a point in the brain that's going to probably respond well to surgical intervention, then you may want to do that instead. And if the parents or caregivers cannot be compliant and do this diet, which is relatively hard, then the diet's not going to work. So, new guidelines, most recent guidelines from the International Ketogenic Diet Study Group to consider the ketogenic diet in a child who's failed 2 or 3 medications, and absolutely if they have a GLUT1 deficiency or PDHD. You might offer it earlier instead of trying medications in certain conditions. Classic ketogenic diet. You've got all kinds of different ketogenic diets, but classic ketogenic diet, like we found at Johns Hopkins, is 4 grams of fat to 1 gram of protein and carb. 90% of energy is at fat. Variations, which are actually more doable for a lot of people, modified Atkins, again developed at Johns Hopkins, utilized at Johns Hopkins, and something called low glycemic index treatment. The advantage with these, you don't have the inpatient fast. You don't have to put a person in the hospital and fast them for 48 hours to initiate the diet. You start out with carbs of 10 grams a day, and then after 1 to 3 months, you bump it up to 15 to 20 grams a day. But you don't limit proteins, fluids, and calories. So it's, with those guidelines, it's much easier for parents to implement with children. The low glycemic index type, carbohydrates actually go up to 40 to 60 grams a day, but these are more low glycemic carbs, and you can even tweak it further by finding out how an individual person responds to specific carbs as far as what their blood sugar does. So the ketogenic diet versus modified Atkins, low glycemic, you really see similar efficacy rates. You don't see a huge difference in how many people get better versus how many don't. And obviously the matter, LGIT, may be better for adolescents and adults. It gives them a lot more control over what they can eat. There are going to have to be some things individualized for people on these diets. Multiple vitamin, they may or may not need additional calcium depending on what all they're getting in their diet, possibly vitamin D. Oral citrates, maybe, partly has to do with their risk for kidney stones. Additional minerals, medium chain triglycerides or coconut oil, it helps with ketone production, and salt. Side effects, just like with about anything, we can have the possibility of side effects, minor metabolic abnormalities, sometimes some GI symptoms that can be dealt with. Constipation will sometimes occur, and we can work around that. A secondary carnitine deficiency may develop because now you're running on ketones and you're relying on these fatty acids getting into the mitochondria. So you might actually have to have additional carnitine to make all that work. Sometimes you'll see an elevation in cholesterol, sometimes a kidney stone. So those are some things that have to be watched out for. So does it work? Well, when they start people on these diets, 75% of the children are going to respond within 14 days. So 3/4 of the kids you're going to know pretty quick if it's going to be helpful or not. And it's suggested that the diet's tried for at least 3.5 months. Often the diet's going to be discontinued after a couple of years. Now, if somebody's got one of these genetic abnormalities where they really need to run on ketones, then you keep it going. So if after 2 years they're not having seizures and you stop the diet, 80% of the people that were on the ketogenic diet are going to still be seizure-free after stopping it. If you look at kids that have been on medications and after 2 years they're seizure-free, about 65% of those will stay seizure-free. So certainly the diet is doing as well with resolving the seizures and keeping kids seizure-free as the medications, often with a lot less side effects. To discontinue the ketogenic diet, it's done gradually, just like if you were weaning off of medications. If you go to clinicaltrials.gov and just see what trials are going on right now with the ketogenic diet, I found 96 listings, everything from autism, epilepsy, different forms of cancer, ALS, Parkinson's, progressive MS, the Walls diet. If you really want some good information on ketogenic diet, dietary changes in multiple sclerosis, look up the Walls diet. Terry Walls is an internal medicine doctor. She developed MS, was getting worse and worse and worse. She was in a zero-gravity wheelchair to see her patients. She could not sit up in a wheelchair. She had to be in a reclining wheelchair to go to room to see her patients. And she decided she didn't want to stay like that. She got out her books, her good cellular biology and biochemistry books, and created a program for herself, and then started eating a really nutrient-dense, paleo-type, autoimmune, ketogenic diet. I saw her last week in Boulder at the Ancestral Health Symposium, up walking around. So a lot of research going on. The reference I used for most of this talk is from this paper. That's it. Thank you.
Thanks. That was great. I just wanted to ask a couple of questions. As far as these diets go, it's often said that, and people here may be concerned about patients cycling on and off, and it's easy to stay on it maybe for 6 months or maybe up to a year, but after that you go back to maybe the old way of eating, possibly with better carbohydrate choices. Any comments on that? Is that acceptable? Is that not advised?
I hadn't done it long enough, and I hadn't been studying it long enough to know. But the neurological stuff was very interesting, that some people continued to not seizure even when they came off. So
Is there any, not to just deflect and be a politician here, but I'm very curious about that. How do we rectify the fact that they came off the diet and yet they remain seizure-free despite not, if the diet's the cause, or do they somehow change their brain metabolism permanently from regulation of receptors? That we still don't know.
A lot of it we still don't know. Ongoing research as how does ketogenic diet work in the brain? Absolutely. But there does appear to be some healing that occurs, not just in epilepsy, but other conditions where the ketogenic diet's employed for a while.
Mm-hmm. To answer Scott's question, that there is a danger, especially if you're using a ketogenic type diet for weight loss, that if you rebound or you start to eat that carbohydrate, you tend to, and I've experienced this myself, you go on a sugar binge. You can't, it's almost like your hypothalamus goes into overdrive and you can't eat enough carbohydrates. So you have to really watch out for that. And I think the long-term benefit is mainly, as you said, making more healthy choices in regard to a carbohydrate-laden meal. I had an old friend who told me 20-something years ago, and he's an old guy from upstate New York, and he's married to my wife's best friend, and he said that sugar's the devil. And this was back in the low-fat, myth that we were living in for years and years. And I thought he'd lost his mind because I was all in for Ornish and all that jazz. He's right.
Now, doctors have known about this for a long time. I remember in biochemistry, I don't remember much about biochemistry. I remember nothing about the Krebs cycle, but I do remember that there was a professor in biochemistry who put up a slide that said, you can eat sugar and get fat, but you cannot eat fat and get sweet.
Very good.
Thank you. Thank you all.